CBD and THC Together, the Entourage Effect. There are around 120 distinct phytocannabinoids found in cannabis plants. These phytocannabinoids interact with the endocannabinoid system, which helps your body maintain homeostasis or balance. Two of the more well-studied and popular phytocannabinoids are cannabidiol, CBD, and tetrahydrocannabinol, THC. CBD and THC are used in a number of ways, and they can be taken independently or together, CBD and THC together. However, other studies show that combining these with smaller chemical components found in the cannabis plant known as terpenes or terpenoids is more helpful than taking CBD or THC alone. This is due to a phenomenon known as the Entourage Effect, which occurs when phytocannabinoids and terpenes combine. Entourage Effect definition. This is the hypothesis that all of the components in cannabis interact with one another and provide a stronger impact when ingested collectively than when taken separately. So, should you take CBD and THC together, or are they as effective when taken separately? Continue reading to find out more. What does the research indicate? The combination of phytocannabinoids and terpenes may give additional therapeutic effects. The Entourage Effect has been researched in combination with a variety of conditions. According to a 2011 review of research published in the British Journal of Pharmacology, combining terpenes with phytocannabinoids may be effective for pain, anxiety, inflammation, cancer, epilepsy, a fungus infection. When CBD and THC used together, it may help lessen the negative effects of THC. After using THC, some people report negative effects such as anxiety, appetite, and drowsiness. CBD appears to help minimize these negative effects in rat and human trials addressed in the same 2011 review. Terpenes and flavonoids, for example, are phytochemicals that may be advantageous to brain function. According to a 2018 study, some flavonoids and terpenes may have neuroprotective and anti-inflammatory properties. These molecules, according to the researchers, might boost CBD's medicinal potential. More investigation is required. The Entourage Effect, like most of what we know about medicinal cannabis, is now merely a well-supported idea, and not all studies have discovered data to back it up. A 2019 research looked at 6 common terpenes separately and in combination. The researchers discovered that the addition of terpenes had no influence on the effects of THC on the cannabinoid receptors CB1 and CB2. This is not to say that the Entourage Effect does not exist. It just signifies that additional investigation is required. Terpenes may interact with THC in other parts of the brain or body, or in a different way. What is the ideal THC/CBD ratio? While THC and CBD may function better together than separately, keep in mind that cannabis affects everyone differently, and everyone's goals for cannabis use are different. A Crohn's disease patient who takes cannabis-based medication for nausea treatment would most likely have a different optimum THC to CBD ratio than a weekend warrior who uses it for muscular pain. There is no one-size-fits-all dose or ratio. If you wish to experiment with CBD and THC, talk to your doctor first. They may be able to provide a suggestion and warn you about potential drug interactions if you are taking any drugs. Keep in mind that both THC and CBD might have negative side effects. THC is psychotropic, and in some people it can produce weariness, dry mouth, sluggish reaction times, short-term memory loss, and anxiety. CBD may result in adverse effects such as weight gain, nausea, and diarrhea. Another thing to keep in mind is that marijuana is prohibited on the federal level, but legal in some states. If you wish to try a THC-containing product, first verify your local legislation. Advice on trying CBD and THC. Begin with a modest dosage and gradually increase as needed. If you're a new or infrequent user, consider 5 milligrams, maybe or less of THC. Try 5 to 15 milligrams of CBD. Experiment with timing to find out what works best for you. You may discover that combining THC and CBD together works best. Alternatively, you may opt to use CBD after THC. Experiment with various delivery techniques. CBD and THC can be consumed in a variety of ways, including capsules, gummies, food items, tinctures, topicals, and vapes. A word about vaping. There are hazards involved with vaping. People should avoid THC vape devices, according to the Centers for Disease Control and Prevention, CDC. If you decide to use a THC vape product, keep a close eye on yourself. If you experience symptoms such as a cough, shortness of breath, chest discomfort, nausea, fever, or weight loss, see your doctor at least once. Is CBD still useful in the absence of THC? When it comes to THC and CBD, separately or together, some folks may not want to use THC but would like to try CBD. There is still a lot of evidence that CBD may be effective on its own. If you want to test CBD but don't want to consume THC, search for CBD isolation rather than full-spectrum CBD. Full-spectrum CBD contains a diverse variety of cannabinoids and may contain up to 0.3% THC. Although this is insufficient to cause a high, it may nevertheless appear on a drug test. Check the ingredients before you buy so you know exactly what you're receiving. The conclusions. Cannabis cannabinoids and terpenoids are considered to interact with each other as well as brain receptors. This relationship is known as the Entourage Effect. There is some evidence that ingesting THC and CBD together is more beneficial than either alone due to the Entourage Effect. The Entourage Effect, on the other hand, is still a theory. More study into the cannabis plant and its chemical makeup is required before we can fully understand its potential medicinal advantages.